The scariest moment of my life was September 6th. I felt a lump. I went in, OBGYN, they immediately referred me to go have a mammogram because I'm under 40. That day they did a biopsy, it was September 6th, and I was diagnosed that day.
We staged breast cancer 1 through 4, and when we first met her, we told her there was a good chance that she had a stage 4 breast cancer, which by definition would not have been curable.
2 little kids, scared to death, cried in the waiting area, cried the whole way home, cried for a good couple of days. My first chemo treatment was October 11th, and from September 6th to October 11th was just, I was in a constant state of fear and the unknown and what's going to happen and am I gonna die?
Whenever you have a very young lady with young children at home and you're told that you have a very aggressive, pretty advanced breast cancer, I think that would be anyone's first thought, am I gonna die of this? And when we first saw her, that we didn't know that was a good possibility.
When we first met Shannon, we were very worried that it had spread into the chest, into lymph nodes within the chest around the great vessels, and it had not. We were delighted that we had really gone the extra mile, even then at the beginning stages, to find out exactly what stage she was, to do some extra testing to find out about that. And once we realized that she was stage 3, we realized there was a chance of cure. And that's, the most important thing, really, one of the most important things you can tell someone.
I had a bronchoscopy and some other testing and they pulled it back to stage 3, which initially would have probably been crazy scary because I was hoping for 1 or 2, but after you hear 4, you're like, stage 3, let's go celebrate.
So Shannon had chemotherapy and immunotherapy. We use an antibody with chemotherapy now for the type of breast cancer Shannon had to help eliminate as much of the disease as possible before surgery. Now that's sort of a newer approach to treating breast cancer, is not to go directly to surgery, but to try to eliminate as much of the disease as possible beforehand.
22 chemotherapy treatments total, 4 surgeries, 25 radiation therapies, and I still have 4 chemotherapy infusions to go and at least 2 more surgeries.
It is a team working together to take care of Shannon and every other woman in Shannon's situation with more or less disease, to make a team that's caring for them and finding the right plan for an individual patient.
I know doctors are all supposed to care, but they truly do. Dr. Silverman, when she told me after the mastectomy that everything had come back clear, she was just as teary-eyed as I was. She was just as happy as my family. And that means something.
It's very important for Shannon to be there for her family and to take care of the kids and to participate in life outside of her cancer treatment, and it's important for us to think about that when we take care of patients, that we know that people have a bigger life than just their cancer treatment, which can be very consuming, but hopefully isn't the whole puzzle.
I knew that I needed to come here. I've had an amazing experience, and I would, if my best friend or my sister-in-law had breast cancer, I would send her here immediately.
My prediction is that Shannon will do very, very well. Her outlook is excellent.